Thank you for the introduction. Today I'm going to present some work from our group using focused ultrasound to modulate brain tissue for enhanced penetration and efficacy of non-viral gene vectors in the brain. And so previously in our lab, we have used focused ultrasound along with microbubbles to disrupt the blood-brain barrier for delivery of non-viral gene vectors. And so I'll refer to our gene vectors throughout this presentation as BPNs. And using this technique, we've been able to achieve robust and localized luciferase reporter gene expression in rat brain tissue. However, beyond the use of focused ultrasound for blood-brain barrier disruption, studies from the literature have shown that focused ultrasound can also enhance penetration of agents within tissue. And so we wanted to test whether we could use focused ultrasound to further enhance penetration of our BPNs within brain tissue. And so to do this, we applied focused ultrasound either with or without microbubbles to a mouse striatum. And so I'll refer to this as our focused ultrasound preconditioning protocols. Immediately following, we performed a convection-enhanced delivery of ZS green plasmid-bearing BPNs. Roughly 48 hours later, we removed and sectioned the brain tissue, which we then analyzed to quantify volume of transfection. Additionally, we were interested in looking at the molecular mechanisms that may be behind this focused ultrasound preconditioning, and so we hypothesized that TRPA1 or TRPV1 calcium channels could be acting as focused ultrasound mechanosensors in the tissue to facilitate enhanced BPN spreading. And so we believe that the mechanical stimulus of the focused ultrasound could be eliciting calcium transients through these TRP channels, which could be leading to changes in cellular morphology and increased hydraulic conductivity in the tissue, leading to enhanced spreading. And so we performed the previously described experiment in both C57 black 6 wild-type mice as well as TRPA1 and TRPV1 knockout mice. And so you can see here all the way to the left, we saw a significant enhancement in transfection volume with our focused ultrasound preconditioning in wild-type mice. The TRPV1 knockout mice all the way to the right look very similar to wild-type. However, this enhanced transfection volume effect was blocked in the TRPA1 knockout mice, indicating that these TRPA1 calcium channels are mediators of this enhanced penetration effect within the tissue. Now we wanted to see whether we could use this focused ultrasound preconditioning to enhance transfection achieved in brain tissue using non-invasive delivery of our BPNs. And so to do this, we performed focused ultrasound preconditioning in one of the striatums in a rat. And so we did this at either 2 or 4 megapascals with a 2.25% duty cycle. So this is a much higher pressure and duty cycle than what we use for blood-brain barrier opening. However, we're not adding microbubbles to the system for this preconditioning sonication. Immediately after, we then intravenously inject microbubbles along with luciferase plasmid-bearing BPNs, and then apply focused ultrasound to both striata to open the blood-brain barrier. And so what this gives us is in each treated rat, we have one striatum that received blood-brain barrier opening only, and one that received preconditioning immediately prior to blood-brain barrier opening. We then performed bioluminescence imaging roughly 72 hours later to quantify photon flux in the tissue. And we saw a significant enhancement in photon flux in the preconditioned striatum with both of our parameters tested. And this was a roughly 2-fold enhancement at 2 megapascals and a roughly 5-fold enhancement at 4 megapascals. Additionally, we were interested in looking at whether this preconditioning was having any effect on the subsequent blood-brain barrier opening. So we performed a similar protocol to what I just described, and then we injected gadolinium and performed T1-weighted contrast-enhanced MR imaging at 0, 2, and 4 hours following treatment. And so you can see the grayscale intensity in each of the striata quantified in the graph on the top right, and we didn't see any differences in grayscale intensity at any of the tested time points, indicating that we're not affecting the magnitude or duration of blood-brain barrier opening. Additionally, we performed DCE MR imaging to quantify K-trans in both striata, and we didn't see any difference in K-trans values between the two. Lastly, we wanted to see if we were seeing any temperature rise in the tissue due to our focused ultrasound preconditioning. So we performed MR thermometry throughout our preconditioning treatment. And so you can see the data here from a rat treated at 4 megapascals. And this particular animal had a roughly 4-degree temperature rise, which returned back down to baseline prior to blood-brain barrier opening. More thermometry data from the treated rats can be seen in the middle graph, and we use this to quantify thermal dose in the graph all the way to the right, which this thermal dose that we're seeing here is much lower than what has been reported in the literature to cause damage in brain tissue. Additionally, we performed IBA1 and GFAP staining in tissue sections, and the slides were analyzed by a neuropathologist who did not note any overt signs of astrogliosis or microgliosis. I would like to thank my advisor, Rich Price, as well as my lab and our collaborators at UVA and Johns Hopkins University. Thank you.
We have a question from the audience. I have one quick question. You mentioned that you measured the CEM, the cumulative dose. Mm-hmm. So what was is it the 41 CEM that we see on the graph?
Is it yeah, it was the graph all the way to the right on the slide.
So the color bar or the graph? What was the value, the maximum CEM?
I believe it was around 0.7.
Oh, 0.7. 0.7 is quite low.
Yeah.
Okay.
So, very nice work. Quick question. What led you to pick TRPA1? I mean, given the diversity of TRP channels and mechanostretch receptors in general in tissue, why did that one stick out in particular to you?
Yeah, so we were just looking for mechanosensitive channels in the brain that may be leading to effects in cellular morphology, and we picked TRPA1 and TRPV1. There were commercially available knockout mice as well, which is another reason to test.
Great, thank you.
You're welcome.
Thank you.